Welcome to Sankofa Center's resource page. I'm Ronnie Shaw, director of the Sankofa Center, and what we're going to do today is give you a complete 101, HIV 101 education course that you can replicate anywhere, whether you're a school or you're an organization or you're an individual, whether you're in Africa, whether you're in America or anywhere else in the world. You can use this information to structure your own HIV outreach. So we're going to begin with the basics of HIV. Okay, the first thing I want you to understand is that HIV lives in body fluids. It does not live in saliva, it does not live in urine, it does not live in sweat. There's 5 body fluids that the HIV virus lives inside. And if those fluids get inside your body from an infected person, you're able to also get the virus. The first one is blood. If someone has HIV, the virus that causes AIDS, the virus will live inside the person's blood. So if that blood gets inside of your body, you're also able to get HIV. Okay, the second fluid that the HIV lives in is semen. Semen is a thick fluid that comes out of a man's penis during sex. Sometimes it's a lot of fluid, sometimes there's a little bit of fluid. If the man is having HIV, then the HIV virus will live inside the semen. So if this semen gets inside your body, you're able to get HIV. Okay, the third fluid is vagina fluid. Vagina fluid is not urine. This is a fluid that is in the woman's vagina, and usually there's more of it when she's having sex. So if the woman is having HIV, the virus will live inside the fluid, which is called vaginal fluid or vagina fluid, inside her vagina. So if this juice gets inside your body, you're also able to get HIV. The fourth fluid is pre-ejaculative fluid, or we call it pre-cum. Now, pre-cum is a fluid that it comes out of the man's penis, and the important thing to know is that it can be there before he ejaculates, before the big semen comes. There can be a little bit of what we call pre-cum on the penis. It's very thin and it's sticky. It's a small portion, and it looks sort of like saliva, but it's actually not saliva, it's semen. Now, this fluid, pre-cum, also has HIV inside. So if the person is having HIV, if the man is having HIV, then that pre-cum, if it gets into your body, you're able to get HIV. Okay, the fifth fluid that carries HIV is breast milk. This is important for expectant mothers or women who have young children, infants. If the mother has HIV, the virus is going to live inside the mother's breast milk. So when the baby is drinking the breast milk, the baby is also drinking the fluid with HIV. And that's one of the ways that a child can get HIV is through the breast. Okay, now we know what the 5 fluids that carry HIV are. We're going to talk about where those fluids get into the body to infect someone. So we call these the doors. You know the fluids, the 5 fluids that carry HIV. Now you're going to learn the doors, or the places where those fluids can get inside to cause infection. Okay, now one of the first places in the body where those infected fluids can enter to cause infection is the penis. Fluid that is infected, such as blood or vagina fluid, if that is infected with HIV, if it goes inside the penis, this man is able to get HIV. Okay, now the second place on the body where infected fluids can enter is the vagina. Now, semen can get inside the vagina. Pre-ejaculative fluid can get inside the vagina. Blood can also get inside the vagina. So if one of those fluids are infected with HIV and they go inside the vagina, this woman is able to get HIV. Okay, now the third place on the body where those infected fluids can enter to cause HIV infection is the anus. Now, this can be anyone's anus. It can be a woman's anus, or it can be a man's anus. Any anus. If blood gets inside of there, or semen gets inside of there, or pre-ejaculative fluid gets inside the anus, then this person is able to get HIV if those fluids had HIV inside of them. Okay, the fourth place on the body where HIV can enter is through the mouth. Now, it is not the easiest place for HIV to enter. However, sometimes you might have a small cut in your mouth, you might have a small sore or opening. Sometimes you might brush your teeth really hard and there's a little bit of a cut on your gums. And if you have a sore in your mouth, then infected fluids that get into your mouth, such as semen or vagina fluid or blood, if those fluids have HIV inside of them and they get inside your mouth, more specifically inside a small cut in your mouth or a small sore, then this person is able to get HIV. Okay, now the fifth place on the body where HIV can enter is called open sores. Now, open sores can be anywhere in the body. Basically, any opening in the body where fluids can get inside, such as blood, semen, vagina fluid, or pre-ejaculative fluid. However, it's mostly in the areas where you're having sex where those cuts normally can lead to, or those open sores can lead to a place where HIV can get into. Okay, now you've learned the 5 fluids that HIV lives inside of. You've also learned the 5 places on the body, or doors, where those fluids can get inside. Now we're going to talk to you about the 3 ways HIV is usually spread from person to person. Okay, the most common way HIV is spread from person to person is sex. That's sex using the vagina, sex using the penis, sex using the anus, and sex using the mouth. Now, the reason why sex is the #1 mode of transmission for HIV is because a lot of those fluids that carry HIV are there during sex. For example, there's semen during sex, and there's vagina fluid during sex, and there's blood sometimes during sex, and there's pre-cum or pre-ejaculative fluid during sex. So sex is the #1 way because it provides an easy way for those fluids from one person to get into someone else's body. The second way HIV is spread from person to person is mother to child. Now, mothers can give it to their children in 2 different ways primarily. For one, during the childbirth process, there's a lot of blood and fluids that the baby has to go through the birth canal, so the baby can be infected during that time. Another way is when the baby is breastfeeding. If the mother's HIV positive, then the baby is drinking the breast milk, and breast milk has what? HIV fluid inside, so that's another way the baby gets it. Okay, and the third way HIV is spread from person to person is blood to blood. If someone has HIV, it's going to live in their blood. So if there's any way from that blood from an infected person to get into your body, then you're able to get HIV. Not just the blood on the skin, but the blood to get inside the body. So that means sharing of sharp objects like needles, razors, anything that's sharp and that can cut through your skin should not be shared. Because if there's blood on it, wet blood from someone with HIV, and that gets inside your body, and that blood touches your blood, you're able to get HIV. Okay, we've learned the 5 fluids that carry HIV, and we've learned how those fluids get into your body, and the different places where they get into your body. We also learned the 3 ways HIV spreads from person to person. Now I want to talk to you about 3 ways to prevent HIV that you can use, or anyone else that you know can use to prevent HIV. Okay, now this is what we call the ABCs of prevention. So A stands for abstinence. Abstinence basically means having no sex. If you don't have sex, then those fluids that carry HIV can't get into your body, like semen, vagina fluid, possibly blood or pre-ejaculative fluid. If you don't, okay, B stands for be faithful to one partner. So basically it means that you should be faithful to one partner who you know is not infected with HIV, and they've been tested over and over again to know that they are not infected with HIV over a few months. And you have to know that that person is also faithful to you. So C stands for condom use. This means using a condom, a latex condom, on the penis anytime you have sex. Now, condoms act as the barrier between one person and the other person, and that can be sex between any 2 people. It stops the fluid from one person from entering the other person, so if one is infected with HIV, it acts as a barrier to prevent those fluids or those juices from getting inside your body or outside your body into someone else.